We are Australis Medical. We're located in Christchurch, New Zealand, and we're specialists in occupational medicine and pain and rehabilitation.
And we're a practice of 3 doctors and 2 administrative staff and a nurse. My role at Australis is firstly managing the practice itself, and then as a clinician I'm primarily a specialist pain medicine physician. We spent quite some time looking around the various solutions, New Zealand, Australia, around the world, settled on Cohort. They were clearly very good partners to work with, open to developing the system for our particular needs in Australasia. It's a very deep piece of software, it's highly customisable, solve the problems that you have right in front of you in the simplest way possible. So it helps me because I know all my documentation is there. We don't maintain really any paper notes.
Every patient that comes in and has any service, we load a patient file for them. So like the appointment is directly related to their information.
It is a source of truth for us in terms of the patient information. Everything that is relevant to the patient is in Cohort. That's what makes it fast to respond to queries quickly. I create a draft note when I see a patient and then often will dictate some additional information and then sign it off later. And that flow of dictation and creating letters to be signed off is very important to specialists, that is as efficient as possible because it can be very time consuming. It has a very good component that faces out towards companies, and so most of our communication is via Cohort with the various companies that we work for. So Cohort, particularly version 10, is good because it has a variety of views. It has a clinical history view where you can see everything that's taken place in a chronological sequence. It has a notes view, so that ability to find the information that you wanted is particularly important for practice management systems, and Cohort does it well.
So every day we use Cohort. As soon as we come in the office, we turn it on. Our day is defined by a set of tasks that are assigned to us or to a team that we're in. These tasks might be asking us to do things like contact a patient and get them to book an appointment and see one of our team. So that really structures our day. I can look at the results that have come in and task them to a doctor to view. So it really is the place we go for every area of our job. Cohort's able to work with other pieces of software to do things like Xero, which is our accounting system. It works with another software to send text messages, and that's for our appointment reminders. So everything is connected and the reporting is connected. We really rely on the support portal. As we're in New Zealand and Cohort's based in the UK, it's really handy to be able to just log our request and we can link screenshots in. The history of our request for help is all in one place, and get feedback in a written form with directions on how to solve our issues. They'll change things for the better. Version 10 that we're on now is really excellent. The end result is more accurate, better data. We're able to provide better patient care and ease the load off of our doctors and nurses.